Next session today. It's a very interesting session. It's co-hosted by Bridgespan. A little bit about the session is the objectives that we want to cover in this session. What is really community-driven change? What do we mean by community-driven change? What is the process of it? What's the resultant impact it has on people, on places, on systems? We would like to see if we could have some learnings that can be shared today by our non-profit leaders on strategies that they've found to measure changes in the lived experiences of these communities. Moving beyond project outputs to measuring communities' power and assets. We also would like to discuss challenges and opportunities for redefining monitoring, evaluation, and learning practices for community-centered organizations. With that introduction, I'd like to invite on stage the panelists for today. Anjali Makhija, Trustee and CEO, SM Sehgal Foundation. Anusha Chandrasekharan, Lead, Programs, Praxis Institute for Participatory Practices. Shri Mangesh Vangeji, CEO and Board Member, Swades Foundation. Praveen Singh, Chief Executive Officer, Apnalaya. Ritika Gupta, Research Lead, CMS. And our moderator for the day is Riti Mohapatra, partner, the Bridgespan Group. Thank you. Thank you all so much. Sorry, it's a packed panel today. I'm very excited to have all of you here. Riti, over to you.
Thank you. Thank you, Gitanjali, and thank you everyone for attending. We know we are the session between you and lunch. So we will try and keep this lively, so you feel more hungry once you feel hungry for more once you leave. Before we start, I think we wanted to run a quick exercise with the audience. We'll have a mentee on the board. I am moving. Great. You'll not be able to see the results. We'll see on our screen, but we just wanted to get a sense check from everyone in the audience. And I have my colleague Kriti to help moderate the mentee session. Just to start, before we start engaging with the panel, just to learn from the audience how you think about impact in the programs that you are driving. How do you think about the different dimensions of impact with the communities that you're working with? So let's start with that, and then we'll come back to the panel.
So the first scenario was, there's a group of women, perhaps a small SHG, and they have been able to manage a small corpus, which has not only led to an increase in their income, but has also led to a shift in gender norms. And we're seeing almost 30, 40 people in the room believe that it's led to a change in both economic impact and a shift in gender norms. With that, I will move on to the next one. The next scenario you see is community members. They get together and they track the incidence of vector-borne illnesses in the community, and they work with the local officials to reduce outbreaks. And so here, what are the potential impacts? One is disease reduction, second is community agencies in action, and the third is both of them. We have almost 50 responses, and majority of you have mentioned that it will lead to a change in both. Quickly, I'll just take you through one more scenario, and then we have a few additional questions on this exercise. Next scenario is a group of farmers who belong to an FPO. They market their produce together, and in addition to that, they collaborate with the Sarpanch to establish a village school with their collective power. So does it lead to a change in educational outcomes, civic participation, or both? Again, I think majority of you have mentioned that it will lead to an impact on both. Now our next question is, so in all of these scenarios, we saw that we touched upon both the programmatic impact and impact on some of the softer aspects, such as communities, resources, leadership. So the next question is, are community leadership, resources, and some of these softer aspects already measured by you or your partner organizations? We're seeing that although there's most of the people in the room are in some form collecting this data, but there's still a sizable population that currently doesn't measure these outcomes or isn't sure. Over the next slide, we would love to know what are some of the challenges that you or your partner organizations face in collecting these outcomes which relate to communities' leadership, resources, and other aspects. We're seeing a lot of responses trickling in, and I believe some of the biggest reason I see is time. There's time, there's the fact that these are not quantifiable. Challenges in data collection, data management systems, resources. So I believe largely some of the challenges we're seeing are time constraints, resource challenges, and lack of ability to quantify some of these aspects. And with that, I will hand it over to Riddhi.
Thank you, Kriti, and that sets us up well for the discussion we wanted to have with our panelists today. I think it is great that towards the end of charcha, after we have spent 2.5 days discussing, how we work better, we talk about what actually changes in the lives of the people we want to work for, what changes for communities, and how would they define their changes for themselves. And in the panel, we have people who have engaged with this very deeply. I will maybe start with the question of why. I think in the first question that I was peeking into the answers that people were giving, we have the broad, audience broadly agreeing that it's important to measure what changes for communities. What do we lose when we don't measure this? Outside of programmatic impact, maybe I'd love for each of the panelists to weigh in, kyun hi karna hai? Even if we don't do it, what is the loss? What are we losing if we just measure, let's say, number of schools or, income increase, whatever programs that we do, there are clearly defined, quantifiable indicators that say, yes, the program is succeeding. But what value do we leave on the table if we don't think about how the lives of communities are changing? So maybe Anjali, I'll start with you.
Yeah, thank you, Bridgespan, and thank you, Charcha 25, for inviting us. So yeah, why I think we all talk about sustainability these days, and I know when we work with the communities, nothing is linear. Social science is not linear. It is not 1 + 1 = 2. It doesn't work that way, because there are a lot of causes and conditions which come together for any impact. And I think with the CSR space, which is another philanthropy space, which is going at a very fast pace, it's not a rat race, right? So I think we all have to realize that it's not a rat race, and we have this I call is law of expanding benefits. So when we measure only outcomes in terms of, for example, we have an intervention in agriculture, Segal Foundation works, we provide package of practices, micro irrigation, and INM, IPM, all those inputs, and there is increase in productivity by 20%. But that really doesn't capture the essence or the impact of all the work which we are, doing. So I think it is very important to triangulate in this context, and we need to have indicators which are resilient, community resilient, which are, replicable, and which can be taken on a very fast pace. So, relevance, replicability, and resilience. These are the three things which will make a long-term change in any activity. And even in the community, in the social impact sector, I think everything is so interdependent, and we need to have those community aspects for sustainability and to see this, as I said, law of expanding benefit. So we need to understand it's a big impact. We are not just talking about numbers.
Got it. So not just profit and valuation, but a bigger scale. Mangesh, I'll come to you. What do we lose if we don't assess this, measure this?
Now, hi everyone. You imagine you are driving a vehicle and there is no dashboard on it, and there is no direction or no speedometer, no petrol meter. What will we be comfortable while driving that? So it is similar. So to me, there are 3 C's: confidence, clarity, and conviction. And for all stakeholders, if it is my community beneficiaries, they should get more confidence by actually looking, when they measure their performance, what the change is happening. We as implementing NGO or my donors, whosoever is involved there, all stakeholders, they get more confidence, more clarity and conviction. Yes, measurement is good. It helps me to keep myself on track. So I think that is very important. It helps us to, as the confidence goes up, conviction goes up, we can have more sustainable kind of a thing. It highlights the gaps where I need to correct. So as human being everywhere, not just in social sector, we all love measuring our performance, whether my kid in the school, as parent, I'll be happy to know that. Teacher would be happy to know how the child is progressing. So very basic understanding, measurement is important, it helps.
And on that, Mangesh, like, why is it important not just to measure like programmatic, but the experience of communities? Like what do we miss if we don't measure that?
Yeah, as I said, I will definitely lose out on what I'm trying to achieve, because I'll otherwise shooting in the dark, right? And we all know any work in social sector, you cannot have like mathematics, X plus Y ho jayega. There's so many differences from context, things change, and I have to modify my approach, my understanding itself undergoes change. Hence that measurement is important. Otherwise, I'll not know whether I'm progressing on the right track or not.
Yeah, I think I remember this phase from our earlier conversation, like surgery successful, patient died. Yeah, everything is great on program, yeah, but the outcome is not there.
And we learn a lot. See, many times we go with very fixed understanding, this is a measurement, outcome, output for my program. But community may have innovated something on a solution side so well, which will get captured. That is another learning which we have seen many times. We have gone to measure something, but we have come back with very positive, surprising results.
Absolutely. Praveerji, same question to you. What do we leave on the table?
So I will share Apnale's experience, because last 52 years we have been working on community development change, community-led change. And if we'll not measure, and if we'll only measure the individual level of impact, like if we have worked on children with malnourishment or women on economic empowerment or maternal health, then it's a 1/3 measurement which we are doing it. 2/3 part we are missing it. Because this maternal health, child health, overall climate, things are not going to like sort it out in a year time or 2 year time. It is evolving and complex problem. Even after 50 years, this problem will be there. Who is going to deal with this problem? Are we there as an NGO who makes a perennial problem and solving it and working on it? It's a cyclic, like let's close one grant cycle and let's start another. Or are we building communities' ownership and resilience to work on it? And that part, measuring the community's ownership in the entire process is the key. Maybe working on issue is the means. When you are empowering the people and people are coming forward coming together, sitting together, formal, informal, casual, in their own neighborhood. That's the big change which we are saying it. And also we need to understand in Apnala's context what we see. Community does not mean that there is a marginalized community and that there is another community. Community means whole. The entire city is a community. And if you have the sense of the community, then even if you are a privileged or underprivileged, how are you participating to make things better as a community? So that is the third level of change which we want to see, that in the entire city level, what kind of impact or what kind of contribution one is making to it. So that's why I said 1/3 is individual. How many children are in school, how many children are in a better nutrition, or how many person with disability with social security. These are the individual 1/3 of the outcome which you have measured. Who has done this? Is it done by colonial mindset? You have done from outside and things are sorted out? Or did you develop some community embedded solution that even if you are not there, people are there to support each other and build their own system? And third, are we seeing them as just isolation, that you are marginalized, I'm not part of the marginalized, or are you seeing the entire city as a community and you are contributing to it? So we measure all the three fronts.
Wonderful. I'm hearing two themes. I'm hearing this thing about sustainability, which is how, if you don't track this, you're not going to be sustainable, you're not going to create intergenerational impact. And I'm hearing innovation, that you actually lose out all the good stuff that's happening on the side that actually puts the community in good stead for their future. I'll come to you, Ritika and Anusha. People come to you when they want to measure this, track this. What do you think, like what has been your experience? What do you think people, like we lose out if we don't?
According to me, Riti, we can't measure it, we can't improve it. We come from a place of, like Mangesh mentioned, we come from a place of understanding that we know what the community wants. If we don't hear it, if we don't go with a genuine listening, open slate of a mind, we will not know what they want. And I'll give a very small example which probably has impacted me in my career more than I would like to attribute. We were doing this, Catalyst was doing this program on HIV prevention in Avahan, and we were focusing on HIV prevention primarily through health outcomes. And when our researchers went into the field, they realized that women working in sex can't say no to sex or a job even if she wants to, because she does not have any money. There is no space for her, a secure access to a bank where she can keep money, some balanced money, that if there is a person who's abusive, who's, let's say not using a condom or not using any preventive measures, she wants to say no, she can't say no. Now, if we had gone traditionally with our approach of trying to measure the health outcomes and all, this research finding would have not come. And when this research finding came, we had the luck that some of our researchers are also practitioners, and they designed this cooperative bank, Swati Jyoti, and it is run with the support of community. Primarily governance board is community. It's a 10-year-old institution. It has a turnover of 25 crores today, and what it does is it provides safe access to financial inclusion and a safe space where women in sex can go save money without any hesitancy, without any shame, and they can say no to work that they don't want to take up, which is transformational, which is much more than any health or prevention outcome that I could imagine. So if that researcher did not go with an open slate, if they didn't come with this answer, if the practitioner didn't take it up, this would have never happened. So
Well, thank you for sharing. That's a powerful example. Anusha, I'll come to you with the same question.
So I think one of the most important things is when we are talking about change, are we looking at the journey? Because most of the things that we said would be measured in terms of the numbers that were shared. We're all looking at what is the outcome, what is the end result. But what happens during the process is going to determine whether that change will continue. So again, sustainability. And also in terms of the journey itself is never a linear journey, because there are a lot of pushes, there are a lot of pulls that happen. And it is important to measure those pushes and pulls. So that's one thing. So again, like when we're talking about change versus transformation, and Ritika has already touched upon that. So when we look at transformation, it is important to look at all these aspects, because unless these things change, like a transformation is not even possible just by counting how many schools or how much income or some of the other things that were shared during the exercise. And one other thing is just to bring in a slight, maybe a question for all of us, is when we are measuring, who exactly are we measuring for, right? So who are we going to put at the center? Is it the project? Is it the initiative? Is it the intervention we are putting at the center? Or is it the community we are putting at the center? Because that is at the core of any kind of community-led participatory processes, including measurement and monitoring. So if we put the community at the center, we will find that these questions themselves become very redundant.
Wonderful. Maybe I'll continue with you then, Anusha. I think move to the next section. I think we spoke about the why, and I think the audience here is aligned. It's like preaching to the choir. Like most of them responded saying yes, this needs to be measured, but there are constraints. Let's talk a little bit about the how. I think you lead a lot of the participatory research in your role. Talk to us a little bit about how would you place communities at the center of the work, and maybe an example to talk us through that.
Sure. So again, it comes to the question of when we are putting communities at the center, it is at what stage are we looking at? Are we looking at communities coming in just at the stage of, say, if you want to do community-led monitoring or community-led evaluations, are we bringing in the community and saying, now evaluate? Now the project has already happened, so now you evaluate. Or are we looking at community-led from the very beginning of the project cycle? And I'm just fresh out of a workshop that Praxis does on participatory methods. And one of the biggest challenges that everyone felt was, in most cases, you come up to visioning the change, and that is given to the implementing team saying, now go implement, right? But then what happens on the ground is the communities are then just becoming recipients of the entire process. So are they part of the even visioning of the change? Because it is their change that we're talking about. It is their lives that we're talking about and their experiences. And so to look at more practical aspects, in terms of in what stages communities can be involved and how, right from the stage of designing the research framework to collecting the data, to analyzing the data, to looking at what to do with the data. So it's a question of who designs research frameworks, monitoring frameworks, who collects the data, who owns the data, who is using the data. So these are all questions that go to contribute to this. Given that Ritika has already spoken about Avahan, so just our experience in that context was we developed a community mobilization monitoring tool, which was long back. But the tool was developed with asking communities what they understood when they're looking at community mobilization, right? Similarly, more recently, our work in the Sundarbans, we have community level theories of change. So does theory of change always have to be something that is top down? Or is there scope for that to be developed with the community? So these are certain things that are there, and there are lots of resources also available, so I wouldn't take more time of the panel.
Oh, thank you for sharing. And Praveen, to you, the same question. I know you've recently undertaken a SROI effort,
Yes.
3-year effort to measure.
It's a bold step to measure the collective process through SROI, social return on investment. It was done by a certified agency. And the learning is that first we understand that what kind of programming we do and how we should measure it. And I will give you a couple of examples that will tell us that how we measure the collective ownership in that. So like as a part of the input, what we do, we as an NGO, what is our strength point? We have resources, we have knowledge, we have relationship with the government. If we can transfer all these things to the community members in a small, formal, informal, transient kind of group, if you just hand over all the resources to them, is it long term? Like I will give you the example of water connection or maybe enumerations bit, where initially when we did, it was like one staff who has helped 20 family members to get water connection. When we transfer this knowledge to the community member themselves, then they are able to transform the entire water connection in that area, that is around 60,000 households. So the difference when we calculated, when we do traditional type of intervention, the return of 1 rupee was 4. When we do through the SRO, the collective process, it was 1:11. Why is it? Because there is collective wisdom, there is collective knowledge, locally knowledge, they have relationship to share, they know their local nuances and challenges, which is otherwise very difficult from outside. And that has reduced the cost, and it has gone 1:11. And there are many examples. This is water connection. Similarly, on maternal health, like one ASA worker is helping 10 mothers or 15 mothers or 20 mothers. When we promoted mother support group, and mother support group who is supporting all the pregnant mothers to taking care of the ANC, PNC, and the reaching to the health services. Who is taking care? The mother support group. They are there 24 hours. So their outreach and their support is much, much higher than when we do from an NGO from outside. And that's the leverage point which we have got in the community. There are many series of examples which tell us that when you involve the community, when you build community embedded solution, your return is going to much, much higher in that. And that's the report. We have this copy here. Happy to share. Yeah.
Thank you. Thanks for that. And it's wonderful to see the SROI results coming from the exercise you undertook. It's unusual, and it's very helpful. Thank you for that. Mangesh, I'll come to you. How do you at Swades measure experience of communities?
Okay, so we have village development committees across more than 1,000 villages. And so there are 2-3 aspects on this measurement, how we do it. One is each village committee is aware that they are being measured and they are part of the measurement. So a very simple system for them as red, green, yellow. And behind that, there is definitely some kind of metric which we have developed, our own M&D team. And we have simplified it for their understanding. And if you go to any of those 1,000 village committees, and you can ask them, आपका कौन सा कलर है? वो बोले हम अभी येलो में है तो ग्रीन में जाने के लिए क्या करना है? ये 2 चीज़ें हमें करनी है. So we have tried to make it as simple and understanding for them. And of course, it doesn't happen in a day. It has taken almost 6 months to 1 year for a committee. They're tribal communities, but we have to really bring it to that level. And they know it is for us. And that is one part. Then there are, from the community, we have created a cadre of Sarvekshan Mitra, who are actually doing a lot of assessment to say of my new orchard plantation mortality rate. They will go and measure in the same village or surrounding villages. And they know it is being done, and it is being shared in the village also, what is the mortality. So that is one practice we have been doing for almost now 6 years, and it has helped us. But at other level, our own internal M&D team, and we have done Dalberg study a couple of years back to get a third-party view also, and that aligns and helps us. But to me, if you ask, as a practitioner, I would still see for the change in behavior on ground, right? That is very important, and that you can see plenty of them. So where I'm entering into a new village where we are forming a village development committee, and even before PRA, last week I was in Nashik, Toran Dongri village, I still remember. I was pleasantly surprised. PRA is going to start on 24th of this month, and entire village is beautifying, because that is one of our condition. Unless you clean, sundar और स्वच्छ नहीं बनाएंगे तो हम काम नहीं करेंगे. Entire village is getting together. सजा रहे हैं मेले की तरह दिवाली जैसे है, and I can share pictures also. I was really very happy that and confident they will do it very successfully. But if you go to a village where we have worked for the last 4 or 5 years, we have seen them doing so many programs which are not Swades programs. Whether going to government to get some scheme for their own village, financial, non-financial, or I keep sharing, maybe in last, you know, Angre Kond is a good example, where we did drinking water scheme in 2017-18. And for us, drinking water project is over, it is meeting its outcome, everything. But in last 5 years, out of these 33 households we have seen, first they started doing kitchen gardens, 30 individual and 3 SHG, not our program. They asked for some training, but they decided. When they started getting a lot of vegetables, women said, "Hum jaake Maharashtra town mein bechenge," which is about 7-8 kilometers, and they started selling. फिर उनको पता चला कि प्रांत अधिकारी के पास there is an authority, they can get space in the town to sell their vegetables. They got the permission, got the space. Last year when I visited, from the profits they have made, they have gone into procuring gir cows and making ghee and selling. Now, this is where, if you ask me, this is a measurement for me, right? How the behavior is changing over a period of time. It may not be measured by any third party or coming out, because they will limit it to only one program, and that is the limitation I think we need to get beyond. Actually, to me, that is the impact. Fortunately, unfortunately, what we hear, and people sitting here will also agree, that most of the measurement stops largely at output or at best outcome level. We say impact, but impact measurement कौन कितना कर रहा है, किसके पास patience कितना है? डोनर को रिपोर्ट 31 मार्च की चाहिए अगले क्वार्टर में, तो इम्पैक्ट देखना है तो ये इम्पैक्ट आप देखिए. So that is how I look at it.
I think one of my favorite stories about like learning about Swades was speaking to community members who said like the biggest highlight was हम लोग दूसरे गांव में गए और वहाँ पे हम लोग को इतने आदर से लोग ट्रीट किए, इतने रेस्पेक्ट हम लोग ने सोचा नहीं था.
Absolutely. And one more, there's many stories I can share. So we do solar panels for water schemes. अब एक सोमच गांव है नासिक में, इगतपुरी तालुका में, एंड पता चला कि सोलर पैनल चोरी हो गए. अब चोरी हो गए, अब क्या करना है? सो दिस पीपल दे डिड नॉट कम टू अस कि भी चोरी हो गए. दे सेड हम अपना पूल करेंगे, हम अपने पैसे से 1.5-2 लाख रिप्लेस करेंगे, कुछ हमारे बॉम्बे में लोग हैं उनसे दान लेंगे. तो दिस इज वेरी पावरफुल इम्पैक्ट फॉर मी, राइट? अब इसको क्या मेजर करेंगे आप? यू कैन से इट इज अ स्टोरी, बट आई क्लियरली सी दैट चेंज, बिकॉज व्हेन वी आर नॉट डूइंग VDC 6-7 years back, वो हमेशा लिस्ट रहती थी स्वदेश से हमको क्या मिलेगा. And there's another village, I can share so many stories. Last month I visited one village in Polatpur Taluka, and they said, साहब हमें अभी आपकी ज़रूरत नहीं है. तो ज़रूरत नहीं है तो बुरा भी लग सकता है, लेकिन हमें खुशी है. I am becoming redundant. वो कहते हैं हमारे गांव में किसी को कैंसर हुआ था, हमने 4-5 लाख रुपए कलेक्ट किए और हम उसको मैनेज करेंगे, आप बस बीच बीच में आते रहा करो. So this is how, I mean, so many things we can measure, right?
Wonderful. Anjali, same question to you. Like, how do you measure what or assess what matters to the communities you work with?
So I will just give you an example, agriculture example, which I was giving. So as I said, productivity has increased for the farmers. Now, when we go back to the same village 4 years later, 4 साल बाद हम उसी गांव में जाते हैं, तो what is the replicability? As a demonstration, what we have introduced, how has it impacted the other farmers? That is, I think, one of the critical areas. And we have been working in Nuh, which is close to Delhi, for the past many years. Now, when we started working there 25 years back, there was almost negligible participation of women. So we introduced this women leadership schools in the villages, where basically the women are brought together and they are given information on various government schemes. Now that is again quantifiable. itne access ke diya, itna programs kar diya. But now, over the years, you see this phenomenal change. In any kind of community meetings, there are this group of women who have never been, who have never stepped outside their houses. They have come together as a collective, and they have taken on projects beyond the project period, beyond the project outcomes. So I think that is a multiplier effect. And one more thing, SROI, which I know Praveen was mentioning, community. SROI, when we take on community processes, I think it is low. We all have to agree that it has to be low. It cannot be 3, it cannot be 4. Pani aapne kar diya, you have built a check dam, you have a lot of water, it will go to 3 and 4. But when we take on community processes, SROI will be low. It will be even 1.5, 2. It's a good indicator. I know you are from the research. So that is our experience. And also we do a lot of qualitative analysis. We do a lot of, we have our own monitoring team, but of course in CSR we have to outsource it. But I think those things are very important, having replicable indicators, having qualitative indicators, and having women groups participation in activities beyond the project outcomes.
That's wonderful. And I think this is also something that has come up in our research as Bridgespan. We've been doing the research on community-driven change, that because these approaches work on strengthening community power, community assets, they lead to sustainable change. And all of what you're talking about says it's not just programmatic, it's outside. There's a lot of indirect positive impact that happens because of it. I know, Ritika, you've been a co-traveler in that journey, and we have tried to demystify power and assets. We did this across 3 countries. We spoke to 800 community members to say, what does power mean to you? Like, how do you think about assets? Can you share a little bit more about how that journey and exercise has been?
So thanks, Riti. I was lucky enough to be visiting some of these Swadesh locations that Mangesh is talking about in the part of the study, to actually see that community ownership. It's just transformational for me as a person to experience that when the community says that aapki zarurat nahi hai, I also want to say that it comes from the start, like that strategy of the program, of the funder, of the implementing agency when they go. I know Swadesh does it. They have like this model where exit strategy as a part, sustainability and exit strategy is a part. I see a lot of funders now at least starting to think about that, that okay, we can be here for 10 years, and if you start thinking about that what does it take after 10 years for me to move out, that's when you can truly start seeing that how community can, leverage it. NRLM, I have been working on the NRLM evaluation for last 7-8 years. So I have seen that whole journey across states, across India. We know Bihar is a pioneer, but I saw that changes, some of these changes in Jharkhand, in Chhattisgarh, how they have moved, I also see a lot of funders now doing sustainability studies post-program period. So, 2 years, 3 years down the line, Nudge, did this one study. And it's not always going to be easy results, right? 100% impact or outcomes that you achieved may not be sustained, but at least we should know about that where we are. So that thinking, it has already started between a lot of funders, program teams, and finally it's about being participatory as, Anusha mentioned. We have this program where we are working with 40 organizations in West Bengal, and we went and made individual 40 TOCs for each of the organization, and not went top down with one fund and going that. So it takes a lot of patience, but that's what community-driven change.
Yeah, no, and you raise an important point that I wanted. Praveen, I'll come to you for this, which is, and this also came in the survey, like, yes, this is good to do, but what is the bottleneck is time and resources. And it's great to know that funders are thinking about this, but is it a difficult thing, Praveen, to convince funders to do this?
It's a difficult and tricky one, because if you want to look for these resources from one donor, nobody is going to give you. Because with the funder and investment point of view, they have their own priorities. Some are very short-term in nature, some are very long-term, some are like unrestricted. I don't care what you do whatever you want. Onus is on the implementing organization. How good you are in blending this finance. You're making all the resources to create a community-driven change. Because this is fact. In the CSR law, you have to report on your outcome. There, if you say that community is getting empowered, ye wo, to nahi chalega. You need to report on your outcome because you are accountable for that. There are institutional donors, long-term donors who are more interested that what number of children you have reached to is secondary. Who has done it? Is it parents? Is it community? Is it a religious leader? Is it a social leader? Who has done it? They see lots of importance to there. And third one is the unrestricted. Who is building narrative around it? Who is getting left out from the entire intervention? So if you have to really build a narrative around the policymaker, around the citizen of your country, then you need to have resources and you need to have evidence. So that also required lots of, all the research agency, how costly they are. To build this evidence, you need to have resources. And that resources will not come from CSR. That resource will not come from the institutional donor. Then you have unrestricted. So how good you are in mixing the blend. And then if you are working on economic empowerment, there is government welfare schemes, there is bank loan available. Are you able to leverage that? If you are making all together in one bucket or one portfolio, and not necessarily that all flow will come as you wish, because things will be, in some resources, you will not have money enough to do it, then how will you do it? So that's why it's a difficult one.
No, thank you for sharing that perspective. I think what I'm taking away is, while there is growing recognition that this is important, more funders are thinking about it. At this time, it's important to be flexible and agile in how you manage the sources of capital to actually do this piece of work and identifying the right partners with which you do the work. One last question to you, Mangesh, and you, Anjali. I know you sort of straddle both sides, right, the funder and non-profit. How do you think about this? Like, how do you think about allocating resources to an exercise like this? Is it a easy choice, difficult choice? And what do you have to navigate to say, nahi, humko ye karna chahiye?
So we have a monitoring and evaluation team in our organizations. We had it 22 years back, we established it. So we were very clear that we want to measure what we want to do and then we want to scale it. So yeah, it is a very, very critical, we fund it internally and that is very, very important and very critical. And with the funders also, see, we have this, what Mangesh was mentioning, we also have a VCCS, VDC, capacity building, convergence and sustainability. There is a model and it is a part of every project. So the donors will not say, no, we will not fund it. We put it in the project itself. And we have indicators, it's a part of the project proposal. Whether they are interested or not, that's irrelevant. We do our own impact assessment, which is a part of the...
So it's a non-negotiable in your...
Yeah, because it is community-led. And many of our partners, they have gone back after 4 years, I won't mention the partners, to assess sustainability. After 4 years, the project has ended. Now, unless we have these components, we always tell them, we cannot guarantee sustainability. It will just fall back. So that is on the table. It's based on our experience and integrate it in the proposal itself. And that's how it has, worked.
Got it.
Yeah, I don't think there's a question of easy choice or difficult choice. I would say there's no choice. We have to do it. As I said in the beginning, conviction, clarity, and confidence definitely comes in. And even Praveen was saying, it is our responsibility as an implementing, or any for that matter, to actually measure it for our own good. As a foundation, we definitely believed in that, and that has helped in the entire journey. When we got listed on Social Stock Exchange, the sector is going through that. And in last 10 years, I have seen this relationship between funder and it is evolving for the better.
Yeah.
It's a mixed experience, some places, but it has definitely moved ahead, if you ask me.
Yeah.
And we follow in our own mind 3P strategy while dealing with funders. One is alignment of purpose. Now, that is starting point. And that is very critical. Second is alignment of principles. Because there are donors, हमारे फैक्ट्री के आसपास 10 गांव हैं, यहाँ पे आप काम कीजिए. लेकिन अगर मेरी VDC रेड है तो मैं काम नहीं करूँगा. Now that is very clearly shared in the beginning itself, and that helps. Although there's some back and forth, and you end up spending so much time in convincing them. And alignment of processes. If, for example, in Suez, all our program, community has to contribute 25% or Shramdan or do both. Many don't say, no, आप community से कुछ नहीं लेंगे. अब ये चीज़ें तो शुरू में we have to align and agree upon, and then we have to tell if you want that kind of measurement, we'll have quarterly reports, but we have few donors, not many. Suddenly they will come, MOU में तो हमने quarterly agree किया था, लेकिन I want every month, or I want these 2 things. This is something in any relationship, back and forth चलता है, personal relationship में भी, लेकिन as long as purpose is aligned, we can manage it. positively.
Well said. Thank you for that. I have some questions from the audience. First one is quite interesting, which is, do we see a role of AI here? Like, can AI play a role in saying impact-based scorecard, which, you know, it uses a less human interface, so less bias in measurement and assessment? Like, is that something any of you have thought about exploring?
I won't say that the narrative can come from the AI because utna context or utni empathy or utni ground understanding nahi hai, but we've seen AI can does wonders with efficiencies on doing dashboards and analyzing and measuring MISs. So agar hamari mehnat wahan kam ho jati hai, we can focus on the narrative.
Yeah, so not asking the questions, but making sense of what's coming is response.
Yes.
I think I've also heard of this. I know Apurva AI is trying to do like a WhatsApp-based, sampling and survey from communities. I think that has started.
So we just signed an MOU with Apurva.ai and I'm going to be piloting it. I'm very excited about it. On the ground, qualitative interviews, I will record on Apurva and transcriptions wahi aa jayenge. Analysis mein wahi kar.
Maybe in the next charcha, you can come back with results from it.
I was just, sorry.
So I actually, these are not my words, but these are discussions that we've been having even in the organization. While we think that AI is not biased, in reality, it's actually very biased because it'll depend upon what are the questions that you ask to the AI. If you ask the same question in a different way, it will bring in different perspectives. Because the AI will also have certain frames from which it is operating, which would usually be like a white, male, Western kind of a perspective. So AI, while we may think is not biased, is actually very biased. I just want to put it out there. I'd like to see what comes out of this study.
Yeah, just a point. I think we have an AI-based digital agriculture initiative. So that is tied to the impact. You know, so sometimes when we have that data, it's mostly outcome, of course. It's not really impact, but we are still working on how it can be on a long term, tied to the impact. I think that is something to think about.
Got it.
And just add, so Dr. Mashelkar is on our board, and he's also working on a lot of AI-based health technology applications. So to me, more than this data, this is very important, what you shared about Apurva AI, and we'd like to know. But I think it will be great help for especially rural and remote locations. AI-based solutions are actually tested. Right now, the challenge is even if there is some AI-based, some healthcare solution is there, false negative, false positive ka bada issue hai. So we have done some pilot, but this is an area we should definitely keep an eye on. Keep knowing more about it, and wherever possible, only what we tell some of our solution provider, don't make us the guinea pig and our community.
Yeah.
That is the biggest risk we have to be aware of. But definitely there is a need to keep an eye on and keep trying to come out with better solutions for communities. I think that is how we would like to look at it.
Great. I think there are two more questions, but maybe I'll start with the one on tech education. Is that something I think there's a question on, have you explored tech education as one of the interventions with the community members, and how would you think about impact, like measuring impact in a short term, in terms of tech literacy in communities? Is that something that you have grappled with?
So we work in government schools where we have introduced digital libraries, and these digital libraries have all the curriculum of school curriculum, and there is a large digital divide in rural and urban areas, especially among girls, because the boys still have access to smartphones, but the girls, they do not. So that was the reason we wanted to have this in place, where even after school, the girls can come and access. Again, we also are introducing some e-resource centers, and again, there is a big gender gap in accessing technologies by women and men. So our focus is to work with the women groups to make it more user-friendly, and it has to be in a place, because mobility is again an issue in the rural areas, especially for women. So a lot of things which are user-friendly, which can be accessed by women. And we also have a community radio. So community radio is another, tech where we invite both men and women. We have it in Rajasthan. We work in 13 states. And a lot of, again, tech-related platform for both men and women. So these are some of the technologies. And I know the youth in the rural areas are really, want to be technology savvy. They want to really, they have that passion and the zeal to, catch up with the urban areas. So anything we introduce just picks up, but takes a little time.
Great. I know we're up on time. Thank you everyone for sharing your perspectives, both about how to identify what matters to community, how to involve community, and how to measure and assess what goes about. I will quickly use the time to do a quick plug, but if the PowerPoint works, but we've tried to research this as Bridgespan, and there's a lot of resources on our website available. We have talked about what are the indicator bank that you can look at just to say what does matter to community and how do you can think about measuring them and how do you involve communities in measuring what matters to them. Thank you. Thank you to all the panelists and thank you everyone for listening patiently and intently.